Good morning. Today is Thursday, November the 19th, and this is our weekly COVID-19 update briefing. Unfortunately, as of last Monday, the Bossier Parish number of positive cases has surpassed 5,000. Tremendous increase. The positive cases in the parish as of this morning are 5,424, which is an increase of 707. The largest single week increase since we've been tracking this now for several weeks. Deaths also, unfortunately, have increased by 14. We are now up to 141 deaths within the parish. That's the bad news. There is some good news in that Pfizer has just announced that their vaccine is 90% effective and should be able to release it before the end of the year. Also, Moderna has announced that their vaccine is 95% effective, and it also appears may be able to be released by the end of the year. And one big difference there is that the Moderna vaccine does not require the level of refrigeration that the Pfizer does. It's more difficult to protect it as it's in transit with the Pfizer, but both of these are good news. The process of determining priorities for who should get these vaccines and when is still being determined, but hopefully before the end of the year, first responders, medical people, vulnerable populations, and others will be probably high on the list of priorities, and it will probably be early spring next year for the general populace can have access to the vaccine. But it is extremely good news that there is a preventive vaccines on the market soon. The state positive tests also have increased tremendously. As of last yesterday, more than 200,000 people within the state have tested positive. That's a percentage rate of 5.9, which is good, but not quite at the 5% or lower that is the goal, but it is a step in the right direction. But that said, the number of positive cases remaining major concerns, and many states have issued severe restrictions to help prevent and mitigate the surges that are going on now throughout the United States. On October the 23rd, the Louisiana House of Representatives passed a petition to overturn the governor's authority to manage our response to this pandemic. The state attorney general has supported with the legislator that this the governor does not have the authority to continue managing. He has been. The governor, of course, disagrees with that and with the attorney general, who has agreed with the House of Representatives. The governor filed a suit in the 19th Judicial District to block this petition. Judge Morvant recently rejected Landry's request for a temporary restraining order. Judge Morvant also held a hearing on this issue on November the 12th, and he ruled that a law used by the legislators in their petition was not constitutional. He said the existence of any legislative power is not on the Senate or House acting alone, but by the concurrent action of both houses. Many people believe that Attorney General Landry will appeal the judge's decision, so it's likely that this will ultimately be decided by the state Supreme Court. In the meantime, the governor continues to follow the guidance he receives from the National Coronavirus Task Force, the Center for Disease Control, and the Louisiana Department of Health in developing the procedures that we're to follow within the state. And he says to abandon these procedures would jeopardize the lives of many of our citizens and the gains we've made to date. In his last proclamation on this subject, number 158, issued on November the 5th, he indicated that the state will remain in phase 3 of the recovery through Friday, December the 4th, or as extended by any subsequent proclamation unless terminated sooner. I believe it is likely that the governor will issue a proclamation on or about 3 December indicating that the state will remain in phase 3 for another 28-day period. The recent surge of positive tests throughout every state in the United States and internationally should make it abundantly clear to everybody that the threat is real. No one is safe and cannot assume they won't be affected by this virus. As we know, some individuals are asymptomatic, but they can still have the virus and can transmit it to others, their family, their friends, and others. And the young adults remain a significant factor in the spread of the virus. It's been said that the symptoms can show up after being exposed within 2 days or as long as 14 days. So there's a big window there where after being exposed, one might not have the symptoms for up to almost 2 weeks. The wearing of masks continues to be somewhat controversial and a major issue of concern, but it has been directed by the governor that every individual in the state, age 8 or older, shall wear a face covering both the mouth and nose. And that's whether indoors or outdoors or in public buildings or open or spaces that are open to the public. And also this applies to when one is on public or commercial forms of transportation. The Center for Disease Control recently determined that young children are more likely to contract and transmit the virus than previously believed. They now recommend, not direct, but recommend that children aged 2 or older wear masks. On November the 13th, the Louisiana Office of Alcohol and Tobacco Control and the Louisiana State Fire Marshal's Office reaffirmed to the state's business community that both agencies will continue conducting compliance enforcement of Governor Edwards' Phase 3 directives. They remain in place. So as we anxiously await these vaccines to be available and put into practice, what can we do to help save lives, improve the economy, and not regress to a lower phase in the recovery? Well, as we always stress, first follow the prevention and mitigation procedures, which I will outline briefly in a moment. Next, flu season is upon us, and whether you normally get a flu shot or not, the Center for Disease Control and other health entities urge everybody to get a flu shot this season to hopefully prevent the compounding of the problem of having the coronavirus and flu season going on at the same time. The governor has stated that should we have an increase in the number of confirmed cases or related hospitalizations, which threatens the ability of our medical community to deal with this problem, it may be necessary to regress to a lower phase in the recovery. None of us hope that happens, but with the number of cases in the hospital increasing rapidly, it's something the governor and all of us will have to keep our eye on very closely. The governor has said repeatedly that it's incredibly important that we do follow the prevention and mitigation procedures, and as always, I will summarize those very briefly. First, wear a mask. Not popular, but exceptionally effective, according to most medical experts. Wash your hands for at least 20 seconds. Cough into the bend of your elbow. Do not touch your face. Disinfect surfaces that are touched frequently. Practice social distancing of at least 6 feet. If you're sick, stay at home and follow the advice of your medical provider. And as always, avoid crowds. Most medical experts are saying that as cold weather approaches now, the problems with the spread of coronavirus are only going to increase as more people stay indoors and are in closer proximity to each other for longer periods of time. They're concerned that small gatherings, such things as weddings perhaps, Thanksgiving and Christmas holidays, the holiday of students from schools, when people tend to let their guard down, could very easily result in a significant increase in the number of positive cases. So it's urged that even though we want to be with family and friends during these times, the urge is to continue to practice social distancing and mask wear to the maximum extent feasible. Ladies and gentlemen, due to the holidays, Thanksgiving next Thursday, a week from tomorrow, week from today, we will not have a briefing unless something especially significant happens during this next week. So no briefing next week unless, as I say, something unusual needs to be shared with you. Our next scheduled briefing will be on Thursday, December the 3rd. And I want to thank all of you for continuing to help us in this war against the spread of this pandemic. I've personally observed, for the most part, our citizens are wearing the mask and attempting to keep social distancing, and I just urge all of us to keep doing so. So I thank you, and this concludes our briefing for today, and good day.